Let's continue with the topic brachial plexus. In this series, we will be discussing about the injuries to brachial plexus. Let's start with Erb's palsy. We'll be considering upper trunk for that. We have discussed earlier about the Erb's point, which is located at upper trunk. Upper trunk is formed by C5 and C6 nerve root. Injury to the upper trunk will cause Erb's palsy. Cause of injury for Erb's palsy will be fall on shoulder or birth injury. Clinical features will be policeman or waiter strip deformity, where shoulder is in medial rotation, elbow is extended and forearm is pronated. So the muscles affected or involved in Erb's palsy will be supinator, supraspinatus, infraspinatus, brachialis, deltoid and biceps. Corresponding movements will be affected. Now coming to lower trunk injury. Injury to lower trunk will cause Klumpke's palsy. In Klumpke's palsy, we can see there is clawing of hand. Cause of injury for Klumpke's paralysis or palsy will be hyperabduction of arm or birth injury. Clinical features will be claw hand deformity, peculiarly seen. In clawing, we can distinguish in a manner such that in lower ulnar nerve palsy, clawing is more marked than in higher one. And also, when only ulnar nerve palsy is present, there will be clawing only in medial two fingers. Whereas when combined median and ulnar nerve palsy is present, there will be clawing of all the four fingers. Now, coming to long thoracic nerve palsy. So in long thoracic nerve palsy, scapular winging will be seen. After that, one more point to be considered is about thoracic outlet syndrome, which is also associated with lower trunk, which may be because of the presence of cervical rib or Pancoast tumor. Erb's palsy compared with Klumpke's palsy. So in Erb's palsy, which is the injury of upper trunk, we can see that there is increase in angle between neck and shoulder. Whereas in Klumpke's palsy, which is lower trunk injury, there will be excessive upward pull of the limb. In Erb's palsy, there will be traction of upper ventral rami, and in Klumpke's palsy, there will be traction of lower ventral rami.